Stroke. Stroke is a medical emergency in which blood flow to the brain is disrupted, leading to brain damage and loss of functions such as mobility, speech, and memory. Strokes can be caused by a blockage or clot in a blood vessel, that is ischemic stroke, or by the rupture of a blood vessel, that is hemorrhagic stroke. As a result, the affected brain cells may suffer from oxygen and blood deprivation, leading to injury or brain death. Ischemic stroke. This is the most common type of stroke, accounting to about 87% of all strokes. It occurs when a blood clot blocks a blood vessel in the brain, reducing or stopping the flow of blood oxygen to the brain cells. Hemorrhagic stroke. This type of stroke occurs when a blood vessel in the brain bursts and bleeds into the surrounding brain tissue. Hemorrhagic strokes are less common but more deadly than ischemic strokes. Signs and symptoms of stroke. Sudden weakness or numbness on one side of the arm, leg, or face. Facial dropping. One side of the face may appear droopy or uneven when attempting to smile. Sudden confusion or trouble speaking or understanding speech. Sudden difficulty seeing in one or both eyes. Sudden difficulty walking or loss of balance and coordination. Sudden severe headache with no known cause. It's important to seek medical attention as soon as possible after symptoms appear, as prompt treatment can reduce the risk of serious long-term effects and improve the chances of a full recovery. Home care for stroke patients. Assist with activities of daily living such as bathing, dressing, eating, among others. Encourage movement. Assist the patient in exercises prescribed by a physical therapist to improve mobility and prevent further complications. Monitor vital signs. Keep track of the patient's blood pressure, pulse, oxygen, blood sugar, and temperature. Administer medications. Make sure the patient takes medications prescribed and on schedule. Ensure a safe environment. Remove potential hazards such as throw rugs and provide assistive devices such as a wheelchair or walker to prevent falls. Encourage communication. Help the patient with communication as they may have difficulty speaking or writing after a stroke. Provide emotional support. Be patient and understanding, and provide a positive and supportive environment for the patient to help cope with challenges of recovery. Risk factors. Age. The risk of stroke increases with age, especially after age 55. High blood pressure. Smoking. Tobacco use damages blood vessels and raises the risk of blood clots. Diabetes. High cholesterol. Atrial fibrillation. This type of heart arrhythmia that increases the risk of stroke. Heart disease such as heart valve problems or history of heart attack. Family history. Obesity. Lack of physical activity. The use of hormonal contraceptives such as birth control pill can increase the risk of stroke in some women, especially those with other risk factors such as age. Women who are over 35 and smoke are at a higher risk of stroke. High blood pressure, smoking, and other medical conditions. Women with certain medical conditions such as migraine with aura or history of blood clots have increased risk of stroke while using hormonal contraceptives.